Influenza virus. It is a type of infectious disease. It belongs to the family Orthomyxoviridae. It is commonly known as flu. There are 3 types of flu viruses: Type A, Type B, and Type C. Type A. It contains 8 segments of RNA and some structural proteins. Also in their envelope there is H, that is hemagglutinin, AMP, N, that is neuraminidase, H AMP, N are with different structures and are named according to their position. For example, H3N2, H with subtype 3, H3, AMP, N with subtype 2 and 2. While H3N2 infect humans, AMP, H1N1 infect both humans, AMP, animals. Type B. It also contains 8 copies of RNA, is with less number of H AMP, N, as compared to Type A. It only infect humans. It is with less mutation rate as compared to Type A. Type C. It contains 7 copies of RNA, it is less common, as well as with least mutation rate. It shows mild illness in children. It infects both humans and pigs. Type C on their envelope contains hemagglutinin esterase fusion protein instead of hemagglutinin, which allows entry and exit into the cell. When infected person sneezes or coughs, it spreads thousands of viral particles through droplets to the nearby area, up to about 6 feet or 2 meter long. Droplet nuclei are then land in mouth or nose, or inhaled, and reaches to the lung. Also, virus can survive on surface for few hours, so it get entry through touching contaminated surfaces, like tabletop, doorknob, etc. When flu virus enters a new body, it uses its hemagglutinin to bind with the sialic acid moiety, present on epithelial cells in the upper respiratory tract. When cell get entry to the epithelial cell by endocytosis, entered RNA is of negative sense. It means, each segment of this RNA with help of RNA polymerase, get converted to positive sense mRNA strands. Before assembly they are translated and then assembled to form new viruses. These viruses again released by budding procs with help of neuraminidase. Neuraminidase cleaves sialic acid at the membrane and help to release these new virus particles. Symptoms: it starts after infection in 1 to 4 days. Many times it is self-curable. But cough persists for 2 to 3 weeks. Severe conditions includes acute otitis, sinusitis, bronchiolitis, pneumonia. Also it lead to antibiotic resistance to S. aureus AMP, S. pneumoniae. Common symptoms include cough, headache, heat or fever, cold and sore throat. Risk age groups: children's less than 6 months, shows encephalitis and febrile seizures. Another complication is Reye syndrome. In this, if children's with flu takes salicylate, they show encephalopathy, means dysfunctioning of brain, as well as liver disorder. Other high-risk group includes pregnant women, adults greater than 65 years, persons with chronic conditions like heart or lung disorders. Diagnosis: 1. Rapid influenza diagnostic test. It gives results in minute, vary on reliability, detects only type not strain. Another reliable methods include virus culture, in which viruses are grown in embryonated chicken egg and identified according to cytopathic effect, and another is polymerase chain reaction, which detects tiny amount of viral RNA. Treatment: it includes 1. Proton inhibitors, usually M2 proton channel inhibitors are used. These prevent replication. Virus M2 gene mutates frequently, so becomes resistant to such inhibitors. 2. Neuraminidase inhibitor, it inhibits neuraminidase and stops virus from breaking out of the host cell. Prevention: it is carried out by vaccination, usually trivalent vaccines are used. Which are: 1. Live attenuated influenza vaccine, LAIV, in this weakened virus sprayed into nose. 2. Trivalent inactivated influenza vaccine, TIV, in this killed virus injected into muscles. Getting vaccinated is of great importance as far as community is considered. Say majority of peoples of community are vaccinated for influenza or any other infectious disease, Such peoples actually protects other members of community. Let's say no one is vaccinated in community. When virus infects one people, it transfers infection rapidly to community and leads a stage that is community transmission.